Have you ever been jolted awake by a loud bang in your head? It's like an explosion went off, but everything around you is quiet. If this sounds familiar, you might have experienced exploding head syndrome. Don't worry, your head isn't actually exploding. Today we're diving into this strange sleep phenomenon. We'll explore what it is, why it happens, and how to manage it. So, let's get started on unraveling the mystery of exploding head syndrome. Exploding head syndrome, or EHS for short, is a sleep disorder. It's part of a group called parasomnias, which are unusual behaviors during sleep. People with EHS hear sudden loud noises as they're falling asleep or waking up. These noises seem to come from inside their head. They might sound like explosions, gunshots, or even cymbals crashing. It's important to note that these sounds aren't real. They're created by the brain, but they feel very real to the person experiencing them. Now you might be wondering what causes this. Well, the truth is scientists aren't entirely sure, but they have some theories. One idea is that it's related to how our brain transitions between sleep stages. Sometimes our brain's auditory neurons might misfire during these transitions. This misfiring could create the perception of loud noises. Another possible cause is linked to other sleep disorders. People with insomnia, sleep apnea, or night terrors are more likely to experience EHS. Disrupted sleep patterns might trigger these episodes. Stress and anxiety also play a big role. When we're stressed, our brains are more active. This extra activity might lead to these startling auditory hallucinations. Sometimes medications can contribute to EHS, especially those that affect the central nervous system. If you're on medication and experiencing EHS, it's worth discussing with your doctor. So how can you tell if you have exploding head syndrome? The key is to pay attention to your sleep patterns. Keep a sleep diary and note any unusual experiences. If you hear loud noises that seem to come from inside your head as you're falling asleep or waking up, that's a sign. Remember, these noises aren't accompanied by any visual elements. They're purely auditory. If you suspect you have EHS, it's a good idea to see a sleep specialist. They can conduct sleep studies to monitor your brain activity. This can help confirm the diagnosis and rule out other conditions. Now let's talk about how to manage exploding head syndrome. While there's no cure, there are several strategies that can help. First and foremost, manage your stress levels. Try relaxation techniques like meditation or deep breathing exercises. Yoga can also be helpful in reducing stress and improving sleep quality. Improving your sleep hygiene is another important step. Stick to a regular sleep schedule, even on weekends. Create a comfortable sleep environment. Keep your bedroom cool, dark, and quiet. Avoid caffeine and electronics before bedtime. These habits can improve your overall sleep quality and reduce EHS episodes. Cognitive behavioral therapy, or CBT, can be very effective. It helps you manage the anxiety and fear associated with EHS. A therapist can teach you techniques to cope with the episodes. This can greatly improve your quality of life. If your EHS seems to be linked to medication, talk to your doctor. They might be able to adjust your dosage or find an alternative. Never change your medication without consulting a healthcare professional. Let's hear from some experts on this topic. Dr. Emily Watson, a sleep specialist, says,
Many people dismiss EHS as just their imagination, but it's a real condition that can significantly impact sleep quality and mental health. Early detection and management are key.
Dr. Robert Kim, a neurologist, emphasizes the role of stress by saying,
Stress is a major contributing factor to many sleep disorders, including EHS. Managing stress through lifestyle changes and therapy can be very effective in reducing episodes.
What do you think about what you heard? We've covered a lot about exploding head syndrome today, from what it is, to its possible causes, to strategies for managing it. If you think you might have EHS, don't hesitate to talk to a healthcare professional. They can help you develop a plan to manage your symptoms. Remember, good sleep is crucial for overall health and well-being. Don't let EHS or any other sleep disorder rob you of restful nights. If you found this video helpful, please like and share it with others. Have you ever experienced something like EHS? Share your story in the comments. And don't forget to subscribe for more health and wellness content. Thanks for watching, and here's to better sleep for all of us.